the medical experts. Adam Chop, a former heart surgeon with nearly one successful operation. His unconventional methods and don't give a hoot attitude make him one of the bad boys of the medical community. Leslie Michaels, one of medicine's most inspirational women. She refuses to let her lack of training or experience stop her from sharing her opinions and advice on all things medical. Ladies and gentlemen, these are the medical experts.
Welcome to the Medical Experts. I'm Adam Deschamps.
And I'm Leslie Michaels.
Today we have a great show for you, filled with a ton of great people and even better medical expertise.
That's right, Adam. We're also introducing a new segment today that we think you'll all really love.
But first, we'll kick things off by discussing some medical rumors that we've been hearing about recently.
All you fellas out there will want to listen up to this first rumor, that drinking large amounts of Mountain Dew reduces your sperm count. You can all rest assured that this has been proven by Adam to be absolutely and utterly false.
That's right, Leslie. Over the course of the month, I drank anywhere from 2 to 12 liters of Mountain Dew a day, and it had absolutely no detrimental effect on my ability to count my sperm.
Is that right?
It sure is. If anything, my sperm count actually skyrocketed, because as the days went on, I was able to count my sperm faster and more accurately, since there were fewer and fewer of them every day.
Well, there you have it, folks. Mountain Dew actually increases sperm counts.
Let's move on to our second rumor, that eating bacon and other red meats can cause cancer.
This rumor is totally 100% false.
We surveyed 200 people who ate nothing but red meat for a year, and found that not one of them had their birthday changed to fall into the window of June 21st to July 22nd.
Sorry, vegetarians. Turns out there are literally no adverse consequences to a diet based around the flesh of farm animals.
Our last rumor is this: giving birth 8 months early actually improves the quality of life of your child.
This rumor is true. That's right. It's been found that giving birth after 1 month instead of the standard 9 can actually help your child out in the long run.
The extra 8 months they have in the world gives them more time to learn the important skills, such as using the bathroom and how to overcome not having a fully developed respiratory system.
Giving birth 8 months early improves the mother's quality of life as well. By not having a human being inside of her for 9 months, she no longer has to worry about things like looking like a zeppelin or having to get over her crippling alcoholism so as to not deform her child.
Exactly, Leslie. And while we're on the topic of pregnancy, let's welcome our guest, former pregnant woman Nancy Barnes.
Well, thank you so much for joining us today, Nancy. We're so happy to have you here.
Well, thank you. It's great to be here.
We were just talking about pregnancy, and you have a pretty remarkable story about your own pregnancy.
That's right, yes.
Now, Nancy, we hear a lot of stories about women not realizing they're pregnant until the day they give birth, but your case is a little different. You didn't realize, correct me if I'm wrong, until 3 years after you gave birth. Is that right?
That's correct, Leslie.
Well, Nancy, tell us, because this is truly fascinating, and I think our audience will agree. How does this happen? How does someone not realize that they're pregnant until their child is already out of diapers?
Well, my husband would tell you that I don't notice most things, even when they're right under my nose. But no, I did see some of the usual signs of pregnancy, but I guess I just didn't put things together until little Blake was 3.
You say usual signs. Can you give us some examples?
Well, let me think. I did notice that none of my clothes were fitting me anymore, but I thought that was just me putting on my winter and spring weight.
What else?
Occasionally, I felt what must have been kicks looking back on it now, but I just wrote it off as my stomach disagreeing with what I had eaten. Oh, and there was this one time, but it's too embarrassing.
You can tell us, Nancy. We won't judge.
Well, okay. One time, a bunch of water started pouring out of my you-know-what. And in retrospect, that probably was my water breaking.
Okay, Nancy, I must ask. How did your water breaking not tip you off to the fact that you were pregnant?
Well, I had just been swimming. And you know when you spend a lot of time underwater and you'll get water in your ear, and it comes out a few hours later? Well, I thought it was something like that, just with, you know.
Okay, that I can understand. But what about once... Your son's name is Blake, right?
That's right, Blake.
So after little Blake was born, how did it take you 3 years to discover that you had a child?
To tell you the truth, Adam, I'm not sure myself. One day I came home to balloons and streamers up, and I walked in to hear my husband and the rest of my family singing, "Happy birthday, dear Blake." I was like, well, wait a minute. I don't know anyone named Blake. What's going on here?
So what'd you do?
Well, I didn't want to be rude, so I waited until everyone was done singing. And then I asked my husband, "Who's Blake?" And he looked at me like he couldn't believe me. And he said, "Well, Nancy, Blake's our son."
Nancy, this really is a fantastic story, and we'd love to hear more. But unfortunately, our time is limited. So let's just get into our advice for you.
Nancy, my only advice is that you start breastfeeding immediately. In terms of nutrition, Lil Blake has a lot of catching up to do from all the years you didn't realize he existed. So the sooner you can get him on some of Mama's milk, the better. I'm recommending that you keep him on the breast until he's at least 5.5.
Nancy, I'm going to disagree with Leslie and give you this advice. Stay out of your son's life completely. He was fine for the 3 years you didn't know you had him, so I'm sure he'll be fine without you for the rest of his life.
Well, Nancy, that's all the time we have for you, but be sure to keep us posted on how your situation develops.
Well, thanks for having me, and thank you for all the wonderful advice.
Of course, Nancy, you're welcome back anytime.
We'll be right back with more medical experts, but first, a word from our sponsor.
After my second heart attack, I knew I had to make some changes, so I went to my doctor and he recommended I start taking corticosteroids. Thanks to corticosteroids, I'm able to maintain the same grease-based diet without the constant fear of another heart attack looming over my head. Corticosteroids are the performance-enhancing substances of the heart. They stimulate the growth of the heart muscles, which increases the strength of my blood flow, meaning that my blood is able to push past all of the cholesterol and plaque in my arteries. That way, I don't have to worry about things like myocardial infarctions or coronary artery disease.
If you want to stop having heart attacks without making any major lifestyle changes, ask your doctor if corticosteroids are right for you. Do not take corticosteroids if you do not have clogged arteries, as a healthy body is not designed to handle such a strong flow of blood. Side effects may include elevated body temperatures, swelling of the hands and feet, and several irreversible long-term effects.
I decided that 2 heart attacks were enough. That's why I started taking corticosteroids. Talk to your doctor about corticosteroids today and get back to living the unhealthy lifestyle that is all you've ever known.
Welcome back. At the start of the show, I promised you we'd be introducing a new segment we thought you'd love.
That's right. So without further ado, it's time for Mole or Mole.
Mole or Mole is a simple game Adam and I came up with. We'll be using our medical expertise to determine if the picture shown to us is a mole, as in the skin thing, or a mole, as in the rodent.
All right, so let's take a look at our first picture.
This is a tough one, Adam.
Indeed, Leslie.
But I'm gonna have to go with mole, and I'll tell you why. The biggest giveaway is the coloration. The specific shade of brown tells me that this is a standard mole.
Well, let's see if you're right. Look at that, folks. Leslie sure does know her moles from her moles.
Now let's take a look at our second picture to see if you know your moles from your moles.
Oh, boy.
Wow.
With this one, it's so hard to tell, but I'm going to say this is a mole, Leslie. And the reason I think that is because of the hair. The kind of short, dark hair we're seeing here is something you'll only see in a mole.
All right, Adam, let's see if you're right. Is this a mole?
I knew it.
Look at that, Adam. We went 2 for 2.
We sure do know our moles from our moles, Leslie.
I guess so. Well, that was a fun segment, don't you guys think? But now it's time to get a little more serious. Each week, we send our correspondent, Danny Collins, to spend a day with someone who is suffering from an incurable illness to get a better understanding of what their life is like.
This week, Danny spent the day with Anthony Evans, who suffers from limb amnesia in both legs. Here he is with more.
Thanks, Adam and Leslie. I'm outside the home of Anthony Evans and his mother, Trudy. I've been invited to spend the day with them. Let's go inside and meet them.
My name is Anthony Evans, and I suffer from limb amnesia in both legs. I've been living with this condition for 3 years.
Anthony's limb amnesia renders both of his legs completely useless. While there is physically nothing wrong with them, he simply cannot remember how to use them.
I remember I was at a rave once, and I was dancing and singing and having a great time, and then I just collapsed. And I tried to get up, but I couldn't. And that's when I realized I'd forgotten about my legs.
It's just been hard watching my baby. We don't have enough room for a wheelchair, and it's really hard because he has to, I look over and he's crawling like a worm. But he never complains. He's my hero.
Currently, there is no cure for limb amnesia. In fact, the American Medical Association does not even acknowledge that it is a real condition. But despite his debilitating condition, Anthony refuses to give up.
For me, it's important to maintain some level of independence. Am I gonna move out of my mom's house? Probably not. Even if I could use my legs, I wouldn't. But things like cleaning up after myself in the bathroom, it's hard, but it's something that I gotta do. I gotta prove that I'm not just some helpless guy who can't use his legs.
It's like these so-called doctors don't even care that Anthony's suffering. They haven't put any effort into helping him. It's just really upsetting.
It's okay. I try to put on a brave face for my mom. But it's hard, I had all these great times with my legs, but I don't think I'll be able to have any more.
What would you say to people who don't understand what you're going through? What do you want people to know?
I just want everyone to take a second and think about how lucky they are to remember how to use their legs. Not all of us have that.
You inspire me, honey. You really do.
No, Mom. You inspire me.
Though it may have taken his legs, Anthony's limb amnesia will never take away heartwarming moments like these. Unless it spreads to his arms, leaving him unable to embrace his mother. I'm Danny Collins.
Wow, really inspiring work.
Great work as always, Danny.
Yeah, great job.
Well, folks, it's that time again. Time for us to wrap up the show. I know. But before we go, me and Leslie will be giving you some parting medical expertise.
That's right. My parting words for you are these. If you're struggling to get that bright white smile, try brushing your teeth with acne cream instead of regular toothpaste.
Does that work?
It sure does, Adam.
Incredible. I never thought of it that way.
You and every dentist and orthodontist I've talked to, Adam.
Well, I don't know how I'll be able to top that piece of expertise, but I'll try. For all of you in the audience and at home who have perpetually cold hands and feet, try this. Tightly wrap some twine around your wrists and ankles, and before you know it, your extremities will be nice and toasty warm.
Wow. How's that work, Adam?
Well, it traps blood in your hands and feet, and as we all know, the body regulates heat using blood. So you're essentially trapping heat in your feet and hands.
Fascinating. Well, that's our show. As always, Adam and I would like to thank you all for tuning in. See you next time.
And remember, we cannot be held responsible for any physical or mental damage incurred as a result of following our advice. Bye, folks!